Introduction prostate health is a major concern for men, particularly as they age. In Australia, two of the most common prostate-related conditions are benign prostatic hyperplasia, BPH, and prostate cancer. While they both affect the prostate gland, they are very different in terms of cause, progression, and risk to life. BPH is a non-cancerous enlargement of the prostate, typically linked to aging and hormonal changes. Prostate cancer, on the other hand, involves the growth of malignant cells that can spread beyond the prostate. Despite their differences, the symptoms of both conditions can sometimes appear similar, such as difficulty urinating or a weak urine stream, leading to confusion and anxiety among patients. Understanding the difference is essential for early detection, proper treatment, and peace of mind. This is especially important in Australia, where health campaigns emphasise men's health awareness, regular GP checkups, and early screening for prostate-related conditions. The good news is that both conditions are treatable and outcomes are often excellent when detected early. In this video, we will explore what each condition is, how they differ, symptoms to watch for, diagnostic methods, treatment options, and the importance of regular health checks for men, what is BPH. Benign prostatic hyperplasia, often referred to as BPH, is a non-cancerous enlargement of the prostate gland that commonly occurs in men over 50. In Australia, it is estimated that over 50% of men in their 60s and up to 90% of men in their 80s have some degree of BPH. The prostate is a small gland located just below the bladder, and its main role is to produce fluid that nourishes and transports sperm. With age, hormonal changes, particularly involving testosterone and dihydrotestosterone, DHT, cause the gland's cells to grow. This results in a larger prostate that can press against the urethra, causing urinary difficulties. BPH is not cancer and does not lead to cancer, but its symptoms can significantly affect quality of life. Men with BPH may experience frequent urination, especially at night, nocturia, urgency to urinate, weak urine flow, and difficulty starting or stopping urination. Some may also feel their bladder never fully empties. Although BPH is not life-threatening, it can cause complications if untreated, such as bladder stones, infections, or kidney damage. Fortunately, many treatments exist, from lifestyle changes and medications to minimally invasive procedures and surgery, all aimed at improving quality of life. What is prostate cancer? Prostate cancer is the most common cancer in Australian men, with over 24,000 new cases diagnosed each year. It occurs when cells in the prostate gland begin to grow uncontrollably, forming a malignant tumour. Unlike BPH, which is benign, prostate can spread, metastasize to other parts of the body, such as bones and lymph nodes, if not treated in time. The exact cause of prostate cancer is not fully understood, but age, family history, genetic factors, and lifestyle all play a role. It is more common in men over 50, and men with a father or brother diagnosed with the disease have a higher risk. In its early stages, prostate cancer often causes no symptoms, which is why regular screening, especially through a PSA, prostate-specific antigen, blood test, and digital rectal examination, DRE, is important. When symptoms do appear, they may resemble those of BPH, such as trouble urinating or frequent urination. However, advanced cancer may also cause blood in urine or semen, speined weight loss, bid loss. Early detection is key, as localized prostate cancer is highly treatable and often curable, particularly when managed with surgery, radiation, or active surveillance. Causes and risk factors. The causes of BPH and prostate cancer differ, even though both affect the same gland. BPH is mainly linked to aging and hormonal changes. As men grow older, testosterone levels slowly decline, but the prostate remains sensitive to DHT, a byproduct of testosterone which encourages cell growth. Prostate cancer, however, involves genetic mutations that trigger uncontrolled cell growth. Risk factors for BPH include being over 50, having a family history of prostate issues, obesity, lack of exercise, and certain medical conditions like diabetes or heart disease. For prostate cancer, risk factors include age, a family history of prostate or breast cancer, certain inherited gene mutations, such as BRCA1 or BRCA2. It is more common in African Caribbean men, though less so in Australia, and diet high in processed meats or low in vegetables. In cases where medication is ineffective, minimally invasive procedures such as Urolift or Rhythm water vapor therapy may be recommended. More advanced cases may require surgery, such as TURP, transurethral resection of the prostate, which removes excess tissue to relieve obstruction. Remember, awareness is the first step, action is the next, and when it comes to prostate health, early action saves lives.